Hello, and welcome back to Bond Air. My name is Jesse Longo, Associate Director of Nursing at Bond, and your host. I am joined today with the ever-present Dr. Jeremy Kimmelstiel. How you doing, Jeremy?
Good morning.
Good to have you back in the stew. Excited. Okay. Not going to say excited anymore. I've been making an effort to not say excited as much as, I think everyone... It's just become an overused term for us. All right. Today, we're thrilled to have Dr. Catherine Ruggiero with us. Dr. Ruggiero is a board-certified veterinary nutritionist and manager of scientific communications of Hill's Pet Nutrition. After earning her Doctor of Veterinary Medicine from the University of Missouri, she practiced as a small animal veterinarian before pursuing a residency in small animal clinical nutrition. Now, as a part of Hill's scientific affairs team, she's helping shape the future of pet nutrition. In this episode, we're going to be discussing recommendations for gastrointestinal support diets, how they can help improve patient outcomes, and what you should know when advising pet owners. Catherine, how are you doing today?
I'm good. Excited to be in this little studio.
In our little studio, yeah. It's great to have you. It's great to have you in person. I love being able to do these in person. I know you're somewhat local. You said it's nice to come down in the city sometimes.
Yeah, for sure.
Emphasis on the sometimes. Right?
Sometimes, yeah. We always like to kind of start out discussing, our guest's journey, what led them to their profession, and I would love to hear kind of from you because nutrition is obviously one of those that there's a ton of passion behind it, and I think I could feel that even in our first conversation when we just met earlier, that's there. So I would love to hear kind of from you.
Yeah, I think I was always interested in nutrition. In vet school, I had the opportunity to take an elective. I know that's not an option for every vet student. There just aren't that many clinical nutrition programs out there in vet schools. But I had the chance to do that and definitely kind of fell in love with it along with the other 3, 4, 5 specialties, right? Because when you're in vet school, everything is super exciting like that. And then when I was in practice, really using it, that's where I honed that love. And started to realize that general practice probably was not my calling when all I really wanted to do was sit and talk to clients about nutrition. And they wanted to talk to me about it. So it was a mutual love. But you kind of know when that bleeding animal comes in and
right.
You want to say, yeah, but what are you feeding?
Yeah.
I don't really care about this laceration. I'd love to talk to you about the weird diet you're feeding. That maybe there's a different specialty for you. So that's really... that love of nutrition grew while I was in practice, and then went and pursued some specialty training in it, which of course just made me love it more. Also realized nutrition clients are some of the most passionate clients out there. So really kind of special owners, special pets that you work with as a nutritionist, which is something that I really liked. So now I kind of get to talk about nutrition a lot, get to advise on nutrition a lot, and hopefully get to help a lot of animals through working for a company that's a science-based pet nutrition company. So really happy that I can do that through Hills.
That's super cool. I have a very ignorant question, which is about the nutrition specialty itself. Is that, as you're specializing, is that something that is focused on specific species, or is the specialty more broad than that?
Yeah, not a stupid question at all. There's a small animal clinical nutrition residency, which is what I completed.
Okay.
So dog, cat nutrition, clinical nutrition specifically. I still got tested on my boards on exotics, which don't ask me to recall any exotic nutrition. I don't remember it. But pocket pets and reptiles and birds were still, a small portion of my training, but most of it was dogs and cats. There historically have been some large animal or kind of combined small and large animal residencies available. There actually, I don't think there might be one person training right now in that field, but there just aren't that many, unfortunately, large animal opportunities for nutritionists.
Right.
So that's become a little bit less common. But
I see.
so most of the programs out there that are training clinical nutritionists are going to be small animal clinical nutrition programs, but you do get every now and then someone who's doing kind of a large and small animal track.
Interesting.
Yeah.
So our focus today is going to be on gastrointestinal diets. I think I always find that to be sort of funny in general. I think when we're talking about diets, we're talking about things that are going to be going through the gastrointestinal tract. And so I think there's obviously, and so my first question is going to be, can you talk to us about sort of the breadth of the products that you guys have at Hills for the gastrointestinal tract, but also maybe talk about that in the context of all of these diets for all of the different needs have to go through the gastrointestinal
Yeah,
tract.
'cause they're all
Yeah,
GI
they are.
diets if you think of it
Yeah,
that way.
exactly.
Yeah.
And so there's how that plays into the calculus of designing specialty diets.
Yeah. Well, yes, there are a lot of different GI diets out there, gastrointestinal diets out there, and I'd say Hills, as well as a lot of the other therapeutic nutrition companies, are going to kind of have a similar type of offering of GI diets across the spectrum of disease needs that you have. So, when we're talking about GI diets, we're generally talking about things that are really highly digestible, and usually, pretty energy and nutrient dense, because patients that require something that's easy to digest, easily assimilated, are going to, need something that's a little bit more packed with nutrients, packed with calories. We also have, those highly digestible, low-fat diets. So that's that other subset of GI diets. And so those tend to be the two big ones we think about when we think about GI diets is, regular, highly digestible gastrointestinal support diet, and then a low-fat version of that, particularly in the canine space. Felines don't really, fortunately, of all the things that cats get, they don't tend to get terribly many fat-responsive diseases, which is excellent. So in addition to kind of those highly digestible, then you have the higher fiber diets.
Gotcha.
So those would kind of be the three big types of GI diets that I think about. But, to your point, there's a lot of other diets that kind of serve as GI diets too. Virtually anything. Any diet's going to be a GI diet, but I also tend to think of like the hydrolyzed or limited ingredient diets. Those specifically can be really beneficial for the GI tract. Some of the recovery diets, so those, high calorie, small volume, maybe can go through a feeding tube type diets would certainly be considered GI diets too. So yeah, I mean, overall, any of those diets are going to be designed to specifically address compromised digestibility, compromised nutrient absorption, and then all of that technology would go into kind of all your therapeutic diets, but with the caveat that it also needs to be appropriate for a stone former, also needs to be appropriate for weight loss, or, kind of have that additional factor. But because all of them are going to go through the GI tract, those same things apply as far as having a profile that's going to be a certain degree digestible, supply certain amounts of fiber, supply certain amounts of nutrients, and supply in an energy amount that makes sense for feeding whatever disease you're feeding.
That's awesome. Yeah. One of the things you just said that I think is kind of like a key tenet to these commercially available dog and cat diets is the technology piece. You actually use that word, and I think that's a hugely important place for us to maybe pause and just talk about. And even specifically with one of the new products that we're seeing that a lot of our vets are using, which is the intestinal biome diet. And so, can you maybe talk to us a little bit about what the technology or the science piece is? I mean, at the end of the day, I think the sort of general understanding of what a nutritionist does is kind of hard for everyone to grasp. Yeah. And I think especially when it comes to veterinary medicine, a nutritionist is a highly scientific specialty.
Yeah, and it's one of those, I think of nutrition similar to some of my behaviorist colleagues, and we all think we feed ourselves every day. How hard could it be? And sometimes when I'm talking to pet owners and they're kind of saying that, like, oh, I cook for myself every day and I'm doing all right. And I try not to say you're probably walking around with a lot of nutrient deficiencies, because most of us are, as just humans are. But it is a really science-based field. And there is a lot of, technology is kind of maybe a scary word. Sometimes I say that and I wish I could pull it back, but it's accurate to describe a lot of what's gone into the commercial pet food, industry is technology and scientific advancement. So that's everything from packaging, which is so boring sounding, but pet food packaging is actually super sexy because it is so, advanced in how it's going to preserve this complete and balanced diet in this single packaging. So everything from packaging to, kibble shape and texture.
Mhm.
Hills does a lot of research in that space and in trying to figure out what do dogs and cats like in terms of kibble shape and texture.
Just imagining how hard that would be for cats to be like, is it just the cat or
Yeah.
is it the
Do you
texture?
actually like this?
Yeah.
So there's some really interesting, palatability is a whole field. And I didn't even know that, there are taste scientists for pet food, and Hills employs quite a few
Wow.
of them. And that's like all they do is look and see what palatants do, dogs and cats prefer, what texture do dogs and cats prefer. Little things like we know that, cats prefer something kind of that's not quite chewy, but more crunchy, like a cracker. That's just the texture that they prefer because of the way that their teeth are, right? And cats don't really chew versus dogs who tend to like something kind of chewy that they can, move around their mouths and little
Very
things
cool.
like that. Yeah. So a lot of, the technology is everywhere from the packaging into the actual, formula, whether it's a wet food or a dry food or a stew, and what size is the kibble and what texture is the kibble and what shape is the kibble. And then where I get excited and the really, nerdy stuff into the nutritional formulation, right? Like what nutrition is actually going into this, not just ingredients. We know ingredients are important, but ingredients are just a conduit for nutrients, right?
Right.
So specifically, what kinds of nutrients do we know interact with the body in what sort of way? And that's where a lot of the Hills research focuses on nutrients and how nutrients impact things like gene expression. So Hills has been pretty active in the nutrigenomics space for a long time.
Wow.
So, how do the types of foods we feed actually change your gene expression? How do the types of foods we feed nourish the gut? Because we know the gut microbiome is this, really important ecosystem that has effects throughout the body. We're starting to identify the gut kidney axis, the gut brain axis, the gut, obviously the gut for gut health too, but all of these other organs affected by the gut microbiome. So how do we adjust what ingredients and nutrients we put in food to actually, feed that gut microbiome and affect health and disease? So tons and tons of technology. Gastrointestinal biome is, I think, a really good example of where that active biome plus is the prebiotic fiber blend that we talk about going into many Hills foods, but particularly in high quantities in that gastrointestinal biome product. And it really is a blend of prebiotic fibers that we've got strong clinical evidence actually does shape and change the gut microbiome, but maybe more important for us as veterinarians, and certainly more important for clients, makes stool quality better, right? Improves stool quality, makes a nice normal poop, and that's what everyone cares about at the end of the day. So that certainly, is really interesting technology that is just one of the things the scientists at Hills have kind of worked on.
Awesome. It's definitely a diet we're prescribing out quite a bit, and in our clinics, it's many of our own pets are on that diet now. I think that the efficacy has been proven just in the anecdotes that we're seeing. I think, is it possible for you to talk a little bit more about what it means to be a prebiotic fiber? And, I think for our vets who are listening, it can sometimes be, we sometimes have those pet owners who come in and kind of really want a better understanding of why we're making these decisions for them.
Yeah. And there is a lot of science behind it. And it can get really confusing. Honestly, when I read microbiome papers, I'm just starting to get to the point where when I see one of those like alpha diversity indexes, I don't just throw the paper away and say, I can't look at this. This is insane. So, this whole idea of ways to modulate the microbiome, modulate the gut, based on prebiotics, probiotics, now postbiotics we're talking about it's complicated. Fortunately, we've, some of that is happening in the human space too. So owners are a little bit more keyed into these terms, or at least understand gut health is important. But when we're talking about foods like gastrointestinal biome, we're talking about prebiotic fibers specifically. Really all that is, it's the fibers to feed the good bacteria, right?
Understood.
Hate calling bacteria good or bad, but to kind of help favor production of that gut bacteria that we know have beneficial effects on the host, whether that's by producing short-chain fatty acids or anti-inflammatory mediators. These are the things we tend to call postbiotics, or these products of gut bacterial fermentation. But prebiotics are just the food, right? And probiotics, which have been around for a little bit longer, I think in vet med, some of us are a little bit more comfortable with the idea of probiotics. I mean, that's just the bacteria, right? You're just giving the bacteria. So it's two kind of different, but maybe complementary ways to think about improving gut health. You know, the prebiotics are going to feed the bacteria. The probiotics are actually giving the bacteria.
Understood.
The problem is if you stop giving probiotics, the benefits of those good bacteria go away, right? We know in dogs and cats that it's pretty uncommon for those probiotics to actually, set up shop and establish a colony there once you stop giving them. So the idea with prebiotics, and really that's what gastrointestinal biome and the active biome plus blend that Hills uses is based on, is this idea that simply by feeding your pet every day, you're feeding them what they need to keep that good bacteria thriving and keep the good bacteria fed and happy, so you have a happy gut. So yeah, it's kind of, there's a lot of nomenclature there, but really if you think about it as, the food that you're feeding is providing that nutrition for the pet, but now we're also taking it kind of a step further and we're providing the nutrition for the gut too.
Really cool.
Yeah.
That's super helpful.
Yeah, I think about the way that kind of human nutrition trends kind of emerge within, pet owners that are now kind of like starting to look at their pet and kind of put that diet philosophy onto them. Is this something that kind of, as the research that Hills is doing, kind of informed by that kind of human side of research into the pet care industry and how you're kind of incorporating it into like the diets that exist now and future?
Yeah, totally. And I think that always happens with pet food is it
Yeah.
tends to mirror human trends, right? So there's a lot more in the microbiome space on the human side than there ever was. I remember looking for articles on the microbiome, and you could Google or go into a PubMed search, and you might find half a dozen articles a year posted on this microbiome or the gut microbiota. And now you go, and every week there's thousands of articles. So certainly it's an area in human medicine that's just exploding and has a lot of potential for personalized medicine. But we see that reflected in the dog and cat space as well, as we're really starting to recognize that this is something people are interested in. It's a field that's growing really rapidly in the human medicine side of things, and so we're trying to support that research on the veterinary medicine side too. We know that's always the problem we have in vet med, right? Is we
Always
never have
lagging
enough
behind,
research.
yeah.
But we're trying to further that research, and Hills has partnered with Harvard on a One Health microbiome platform to kind of create a space to be able to share all of the research that's coming out, because we also know that they're related, right? There's really interesting things happening in the human population when we talk about the microbiome, but humans live with pets, and we know your environment affects your microbiome. So there's a lot of cross pollination that happens
Yeah.
in the environment that dogs and people, or cats and people are in together. So there's really interesting research happening just too, and how we are kind of all existing in this space where our microbiomes might reflect some of that environment that we're all in together.
That's fascinating.
100%. I mean, I think the benefits of owning pets has always been, emotional, mental, behavioral, all of these types of things that we know exist. But I think many of us who have worked with pets our whole lives think that there might be something more there. And it's, now that we have a lot of this research coming out with the microbiome, that's certainly something that has crossed my mind, because it's just you're adding another living organism into the home,
absolutely.
for which you're sharing probably more than people even want to know.
I was going to say,
Yeah.
or care to admit.
We don't talk about that, yeah. But yeah, no, absolutely. And so, a One Health approach to the microbiome is something that seemed really natural. And there's a great group and researcher out at Harvard that is interested in this too. So Hills has kind of partnered to say, let's start really looking at this. Let's start looking at the microbiomes of pets and people, and let's put that research out there and see if there are trends we can start picking up on. Maybe there's ways we can modulate and benefit health of both, right? And we all of us in vet med want to be good stewards of One Health. So it's an exciting area.
Totally. You mentioned personalized diets. On the human side, I think in going into this conversation, especially when focusing on like gut biomes and things like that, do you see research or kind of like a future of like personalized pet diets in this way as well?
Yeah, I mean, I think the more we do in the genetic space, right, and the more that we're doing in the microbiome space, it's so amazing what we're starting to see in people, right? Where
Mm.
you can look at someone's microbiome and predict whether they're going to respond to one chemotherapeutic agent versus another, and we're starting to do that, in the vet med space too. So, I imagine there's going to be a time in the not so distant future where you're able to make really personalized, specific recommendations for a pet based on their genetic profiles and based on their gut, microbiome analysis and things like that, which will be very cool when we start talking about, maybe focusing more on feeding for health.
Hmm.
We obviously as veterinarians have this kind of reactive approach often to recommending foods when there's an illness there. We're not always so good at proactively recommending food for healthy pets, which should totally be part of the conversation, but tends to fall off
Yeah.
the radar in the exam room, right? When you've got a healthy pet in front of you. But I think as we start to gather more information about, what are these genetic links to nutrition? What are these microbiome links to nutrition? And what are individual animals predisposed to? We could, be a lot more proactive about making those healthy pet recommendations. And right now, there's so many really amazing foods. Of course,
Mm.
Hills makes a lot of really amazing foods, but there's so many amazing foods on the market that really do support health and have a lot of great science behind them, to the point where I often think, boy, if I could eat a pet food. Please don't. I have to say that on here. Please don't eat pet food as a human. It's not meant for human consumption. But there's so much that's gone into providing this like super complete,
balanced, yeah.
balanced, nutritionally optimal diet for different life stages and different health conditions and different predispositions. That we probably don't use them as much as we should. I know we don't. I do because I'm a nutritionist.
Yeah.
But everybody else, I'll say we all as in vet med just don't use them enough and think about them enough in healthy animals. And that's where I really see, more personalized medicine coming in is in that health space.
Yeah.
Is how can we prolong that healthy period?
Yeah, I mean, I think we're missing probably in all facets of medicine, whether it's veterinary or human, this preventative approach. And I think, diets obviously play a big role in that, but we've been talking about it here too with a lot of the other stuff that we do and the conversations that we're having with our veterinarians to then have with our clients is, let's start to set up a more preventative approach. And so we're not having to be so reactive when something comes in, more ill in the future.
Yeah. I love it. I think that's where the hope is, right? The goal is to get that longer, healthier lifespan that we know all pet owners want.
Pivoting to a bit of when we were recommending these GI diets in these cases of, a pet coming in with some condition where a diet might help.
Diet will always help.
Diet will always help. I guess my question is like, with all of this information and like the ability to really display the value to a client of like why a vet is recommending this, what kind of resources can you point like either our vets to or even clients towards when better understanding kind of like where these recommendations are kind of coming from?
It's always risky online, right? But there are some really great online resources for good pet nutrition information. There's some really not great online resources for pet nutrition as well. But obviously, hillsvet.com has a lot of really great information on it that is open and accessible to pet owners. There are some really fantastic, blogs out there that are really designed for a pet owner audience, provide good, accurate, science-based nutrition. So, Tufts has a nutrition blog. Pet Foodology. Pet Foodology is the Tufts nutrition blog. And that's a really, great resource for pet owners, searchable. There's some nutritionists that have, some personal blogs out there. Dr. Lisa Weeth has Weeth Nutrition, which is a really great one. So there's some good sources of information that are, providing nutrition information for pet owners who want to dig a little bit deeper. For veterinarians who want to dig a little bit deeper, I'm delighted to see how much more nutrition is showing up on CE schedules at big conferences. The nutritionists, our specialty has officially been adopted as the 6th specialty within ACVIM. I know. Woo is right. Yeah. So it's really exciting. So we're seeing a lot more nutrition amongst specialist conversations too, because sometimes I would argue our general practitioners are better at recognizing nutrition.
Words.
Yeah, I know. I don't know. Maybe I shouldn't say this, but you know, when you get into specialized, you know, in your specialty, you kind of sometimes forget that nutrition is a part of every specialty, right? So there's just a lot more nutrition education out there for veterinarians. So I encourage people to take advantage of that as much as they can. And I think we're trying to shift some of that education, especially at Hills, to not only teaching veterinarians and our veterinary technicians and our vet healthcare team about nutrition, but how to talk about nutrition,
Exactly, yeah.
right? Because I think for a long time we all said, well, nutrition's kind of easy. Nutrition's easy. It's not easy.
No.
The board exam was not easy. I'm telling you, it's not easy. And it's exploding. It's growing so fast. So kind of taking a step back, we're looking at it and saying, well, okay, maybe it's not easy. How do we make it a little bit more accessible? How do we make it a little bit easier? How do we make it clear to pet owners that we're making a recommendation for a diet, not so we can sell a pet food, but because there's a really specific benefit to providing this nutritional profile to this pet at this time. And this is how it's going to, you know, impact the particular dog or cat in front of you. This is how we're going to make a difference to managing this condition or to supporting this disease process. So I definitely encourage people to just seek out some of those opportunities. Again, you know, Hills Pet has great ones for pet owners. Hills Vet has great ones for, you know, veterinarians. But there's also just so much great CE out there now. And as our nutrition college is growing, I get to see my colleagues out there speaking more, and so it's something that's a lot more accessible than it used to be.
Amazing. Well, I think it's time to transition into our segment, Clinic Conversations. This segment, we collect questions from our clinic team, what's on top of their minds as they're thinking about the topics that we discuss on these podcasts episodes. And today, nutrition is one, like we already talked about, is a hot topic. And so we have one question for you today, because I think we covered a ton of like where our vets and nurses' minds go when we think about diets. But our question for you today is, are there any emerging theories on whether constipated cats should be receiving high fiber or low residue diets?
It's a hot topic.
It's a hot topic.
Yeah, that's a challenging topic too. Those constipated cats are kind of a nightmare sometimes to be managing in practice, and a nightmare for owners. Emerging, I would say the kind of emerging field is, again, coming back to this microbiome. We're starting to realize more and more how much of an effect the gut microbiome and overall gut health has on multiple disease processes, but especially at, you know, the level of those enterocytes and those colonocytes. So that would probably be where a lot of the emerging research is coming out, is maybe it's not just about fiber, right? Low residue, high fiber. Maybe it's about the type of fiber. And, you know, as far as helping to reduce recurrence rates of this, maybe it's about feeding the gut the right types of fiber so that intestinal motility is kind of ideal. And so stool quality and fecal moisture content is ideal. And that can all really be, you know, directly affected by the gut bacteria. So that would be kind of the emerging areas. In general, the which way do we go with a constipated cat? It's a tough one. I mean, my general rule is, if we're concerned that there's no motility there, let's not pack it full of fiber, right? It makes sense that we wouldn't want to fill that colon up. So in those cases of, you know, megacolon, especially where you're kind of end stage and you really don't think there's much motility at all, that's when you reach for those low residue foods, because they're going to produce the smallest fecal volume possible. And we just really want to have as little go through there as possible. It's having a hard enough time getting through to begin with. For those cats where we know that they've still got good motility, then those are those cats where the higher fiber tends to help, right? It tends to help stimulate colonic motility if there's normal motility already there. And again, specifically, if we can stimulate it with fiber types that are also going to have beneficial effects on the gut microbiome, even better. So that's where, you know, gastrointestinal biome, prescription diet gastrointestinal biome, has some really great clinical studies in cats, not only with chronic diarrhea, but with chronic constipation. And the benefits of that food have been really overwhelming. The cats do really well on that as long as they can tolerate higher fiber, as long as they have normal intestinal motility, which most of these kitties do. You can really help improve the clinical signs, but also, reduce recurrence rates of these constipation issues if you're helping to make sure the gut, microbiome is happy. So, yeah, it's a good question on which do you reach for when, but ultimately it comes kind of down to that individual cat and where they are in their disease process. And I think we've got to watch that microbiome space, because that may be a real key to helping these cats long term when they're repeat offenders and we don't know what else to do with them. So yeah, those are tough. I'm getting like enema flashbacks from practice.
Oh no.
It sparks just one last question from me, which I think is maybe a challenging one to answer. It's really a product question for somebody who works at Hills. But, I think historically WD was a high fiber food that we used to reach for and was super helpful when we needed more fiber in the diet. I think maybe by design for that food, especially for overweight animals. Yep. But I think, in general, I was using that therapeutically a lot more for, constipated cats or other reasons for me to increase fiber into the diet. So with intestinal biome, I guess the question is, does that trade the same? Does that sort of, can we use that in concert with or instead of?
Yeah, I think, gastrointestinal biome is a reflection of the latest research and science behind constipation and diarrhea. So for fiber responsive GI disease, it's usually my first try. Also because the clinical studies with that food show that the response rate is so rapid, and we know owners sometimes aren't willing to give it 2 weeks to see if the diet ends up working, right? And so with gastrointestinal biome, we see usually within 72 hours you have almost complete response in a lot of these cats. So and dogs too, for diarrhea purposes. So I always reach for gastrointestinal biome first. Again, it's a reflection of kind of the latest technology that's out there. WD is also a high fiber diet. They're both high fiber diets, but WD is a lot higher in insoluble fiber. So the fiber that's in there is really in there with a specific purpose. All fiber is not created equal. So the fiber that's in WD is really in there to help lower caloric density. So again, for those overweight animals, the fiber that's in there is to help increase stool bulk. Can be beneficial for constipated cats, but maybe not all constipated cats. The fiber that's in there is also designed to help blunt those blood glucose spikes that occur postprandially, right? So it's specific for those diabetic animals. So for GI disease, WD, it's a great food, and there are still some animals that do great on it. But my preference is always gastrointestinal biome first, unless I have a real need for something lower calorie, lower fat, some of those features of the higher levels of insoluble fiber, or just higher levels of fiber, period. Because gastrointestinal biome is actually not that high in fiber. It's the type of fiber that's so impactful. Yeah. And it can come in a really elegant package, and so it's just not as high a fiber diet, but it's the type of fiber that's in there specifically designed for helping GI disease.
That distinction, I think, is going to be really helpful for hopefully for our listeners.
Yeah.
Because I think I've had the question, and so I'm hoping that other people have had the question. Maybe other people know better than me, but
no, it's a tricky one, and there are times when I'll use WD, I'll still have reasons for it. I'll use gastrointestinal biome, and I'll say, you know what, this is not packing enough of a punch with fiber. I need something even higher in fiber. And then, WD can be great for that, especially, if you don't need that kind of specific prebiotic fiber blend. So it's, again, kind of along with microbiome, one of the areas that's just grown so much is our understanding of fiber. We used to just think fiber, right? Crude fiber, you look at it on a label, and now we're recognizing so much that it's the type of fiber. What's the source of fiber? Is it soluble? Is it insoluble? Is it a prebiotic fiber source? How much of each? What's the ratio of each? What's the total dietary fiber? It's a lot more complicated of a question than just high fiber versus low fiber, right. Which again, as a nutritionist, gets me really excited. But I recognize that that's also can be a really challenging thing to understand when you're on the clinic floor and you think, okay, my training said reach for a high fiber diet. Gosh, what does that even mean anymore? Because there are a lot of options out there that would qualify as quote unquote high fiber.
Right. Well, that was really helpful. This whole conversation's been amazing. So thank you so much for coming in and teaching us. We hope to chat with you soon. Maybe we'll choose a different specialty diet or different body system that needs.
Anytime.
Now I feel we've cracked the case open. We're gonna talk about every diet that we can now to emphasize the importance of nutrition.
Yes.
Catherine, thank you so much for hopping on. Where can the folks find you? Find Hills?
Our veterinarians, hillsvet.com is a great place to go. We have our Hills Vet Academy there. I have a few things on there that if you want to find me specifically, but otherwise some great educational opportunities out there. We're going to be hosting our Hills Global Symposium here at the end of October, the 24th and 25th, all about microbiome actually, so it's perfect. If this piqued your interest as we were having this chat, then you can live stream or on demand stream Global Symposium. It's going to be 2 days of CE all focused on the microbiome. Otherwise, find me on LinkedIn. I'm sort of a social media ghost otherwise. Sorry, I feel very old saying that, but yeah, and you can find local your local Hills reps anywhere, and they can always put you in touch with me. So
awesome. Thank you everybody. Thank you, Jeremy, for being here. We'll see you guys later.